Running commentary or silence followed by a summary. Which one do you prefer? I'm talking about the MRCPCH clinical stations, and when you're about to present a case, how do you go about it? Some candidates prefer that while you're examining the case, you give a running commentary as and when you're finding the clinical observations, you keep a running commentary and then do a summary at the end. The other way of doing it is that you keep silent, you just keep a mental note of all your findings, a very quiet silence, and then at the end, you sum it all up and give a brief summary of the finding to the examiner. Now, a lot of times the candidates ask me, MRCPCH candidates, which one to go for. Now, I would say this is a personal choice. I personally prefer, as many of us do, to give a running commentary, especially in, I would say, almost all the clinical stations except perhaps the cardiac and perhaps the CNS stations, if it's a CNS case. Why? Because in most of the gastrointestinal GI cases or abdomen or other like examination of chest, if it's a pretty much straightforward examination, step by step, you can get it out of the way. You don't run out of time, because very often by the end of it, when you're doing the summary, you might forget a few things. But in cardiac, very often you have to think of what the sound murmurs are, and you have to add it with the diagnosis or differential diagnosis, which you might have to do right at the end. So, depending on which one you're comfortable with, you can go for running commentary or summary at the end. Hope that helps. Till next time.